You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. In fact, according to my first guest, he says no more dentures, that nobody should be wearing a loose-fitting denture. And with us, we have an expert on the topic, Dr. Cipra. Dr. Cipra, welcome to the program.
Thanks, Randy. It's a joy to be here.
Now, before we get into today's topic, for people that don't know about your center, ClearChoice, who's the typical patient? And, what are the different services you offer, and what is your role in the center?
I've thought about that before, but there's really no typical patient. We have such a variety. But if I was to try to zero in on a couple of groups that might be construed as typical, one is the patient who hasn't been to see his dentist in 10, 15 years or more. And the other one is the patient who has seen that dentist 10 or 15 years ago, was told that their teeth were no longer any good. They needed to have them removed. And dentures was going to be the next step in their dental career. And they haven't gone back since that issue. But we have patients who come in who maybe need one tooth. We have patients who come in who might need 3 or 4, 5, 6 teeth replaced. And they want to do it in such a way that it's teeth that don't come out. They want them to stay in their mouth their entire time. So there's really no age requirement. We have patients who are in their late teens. We have patients who are in their 90s.
Is that right?
And it doesn't seem to matter as long as they're interested and willing to have their whole smile and their life corrected by having teeth that aren't going to be coming in and out at different times of the day or night. We have the answer.
Now, the denture wearers.
Denture wearers,
At the top of the show, I said that you say no more dentures. Is that your belief, that nobody should be wearing a traditional denture?
No, absolutely not. That is definitely where we are today. I have patients who come in and I'll say, if we were sitting here in 1965, or maybe in as late as 1975, we could talk dentures. Today, that's not where the state of the art is. There's better out there. If you're willing to accept yesterday's dentistry, well, then the denture is optional. But if you want what's best for you, healthy, then we need to get rid of the denture and put you into some teeth that stay in.
You say you transform people's lives.
I believe that's exactly what we do, because we're taking people that can't chew their food very well, they don't smile, they're reclusive for a variety of reasons, and we're putting them back into society. And that end of the day, when we transform that person and they leave with this new smile, it's the best part of my day. Fortunately, it comes at the end of the day, so I can enjoy that and then go on to the rest of my evening. But it's true. We definitely transform people's lives. And when they come back and see us a week later, a month later, we hear all about what's going on. And their families are there. We had one lady in the other day, brought in three other people just to discuss how her new teeth were going to look. It's a family affair.
Now, in your advertising, like 30-second advertising, that you could do things in the same day. That means they walk in without teeth, and they walk out with teeth, like that are fixed in their mouth. Is that true?
That is absolutely true. When they come in that day, when we're scheduled to put the implants in and then secure their teeth on them, it's a one-day event. And it's really funny because when we talk to these people the first time and we're doing a consult with them, they ask that question. You can really do this in one day?
They ask you that?
Oh, yeah.
Like they don't believe it either?
No, they don't. And they said, I remember one gentleman recently says, okay, so I'm going to be without teeth for how long? I said, a couple hours. And then that's the amount of time it takes for us to finish what we do initially, give the teeth to the laboratory, let them finish it. Our technician's awesome at that. And then by the time they come back in, it's done 2 hours later, we put you in teeth, and away you go. That's really all it takes. And I should say that on the average, it's just about 2 hours. That's the only time that they're really without teeth.
We should mention how it's normally done and the way you do it. The way it's normally done, and correct me if I'm wrong, you go to a surgeon, they do the surgery. Then you go to another office, and then a dentist will put the teeth on top, and you may go somewhere else for the imaging, and then they send out the teeth to the lab. You do it all right there. Tell me about that process.
Well, what you described is typically what's been going on in the past. What we've been able to do is put all of those locations under one roof. We have our surgeon, we have the imaging in our center, we have the laboratory and the technician right in the center. We have me doing the teeth with the patient.
You're in Kansas City, and you draw from people, you say travel.
Right.
Like 2 hours away to see you.
We're on the Kansas side. We're in Overland Park, but that's Kansas City. We have patients coming from 3-4 hours away. It's not uncommon to have people from Iowa or Nebraska.
Because of the speed, because you guys are able to do things quickly?
Well, or
what's your take?
I think it's because it's not offered where they live.
Okay.
They finally have identified that there's a place that they can go that can give them the answer that they've been searching for, and we're the place that they come to. From as far away as 4.5 hours, Oklahoma. So we're the most convenient location for those folks.
So in regard to denture wearers, right, are there a lot of people where you are that have dentures, like an upper or lower denture?
There's a lot more people than anybody realizes. There's tens of thousands, hundreds of thousands perhaps.
But if it's so good, you know, if getting dental implants, I guess the whole idea is to attach a full set of teeth that don't come in and out.
Correct.
If it's so good, why aren't they all doing it? What's your take on it? I mean, if there's that many people wearing dentures.
I think there's a lot of good reasons. And then what I can explain to you is what I've been hearing. First of all, we have patients who are denture wearers. They figure that's it. They're at the end. They've gone through all the fillings. They've gone through maybe the root canals. They've gone through the periotherapy. They've had their partial dentures, and now they're in dentures, and this is the end of the road. Well, it was the end of the road, but it's not the end of the road anymore. So those folks may not be tuning into dental information.
So they don't get their options.
I think maybe
they don't know about it.
Yeah, I think they don't know. And then obviously some of those folks are elderly. Maybe they're not on the internet or on the computer like the younger people are. So they're missing some of that information as well. With social media, totally is different than it used to be when they were doing it. To them, it was a phone call or meeting your friend down at the cafe for a coffee. It's a different story today. I believe the other reason people come in or don't come in is because they're afraid of the dentist. We have a lot of people who come in and say, well, I suffer from white coat syndrome.
Nobody wants to go to the dentist. Do you hear that, by the way? What do they say?
Every day. Doc, no offense, but I hate the dentist. It's not personal. They're not throwing.
Do you have a good comeback, by the way, after all these years?
You know, I probably do. What it is, it varies with the individual, just because the individuals, some of them are serious, some of them are doing it jokingly. I said, yeah, well, I can do nothing about the past, but I can do something about the present and the future. So we can change all that. So yeah, that's another big one. They're afraid. There's fear of that. And I think there's two things that drive us. One is passion and one is fear. So we're going to avoid fear and we're going to shoot for passion. Okay. So if the fear is pain, if the fear is the doctor, if the fear is maybe I'm a bad candidate. A lot of patients, I think, self-diagnose. They say, it's not going to work for me. Nothing's working for me.
Well, you can be too old. I mean, isn't it true if you've been in dentures like 30 years, you're too old or you don't have enough bone? Isn't that true? As
far as bone is required to put implants in. So sometimes patients don't have enough bone, but we have ways to improve the quantity of the bone so that implant can be made. And then I have patients who come in and say, well, I saw my dentist the other day or last week or 6 years ago. He told me I didn't have any bone. Well, they're making that decision without the benefit of that imaging system that we have. We can look at that right then in front of them. We're showing the patient, yes, you have the bone. Your dentist didn't have the equipment.
So they are skeptical. They come in and say, Doc, are you sure?
Well, they believe their dentist, yeah.
Okay.
But if the dentist doesn't have the technology to give them the right answer, or the best answer, because they're limited, they're not lying to them, they just don't have the means to be as accurate. We have the means to be accurate and tell them, yes, we can do this. No, we can't, but we can do this, and that'll work.
I know you brought photos. We're going to get to those photos. We'll take a quick break. And when we come back, I want to know a little bit more about the process, what they can expect on that consultation. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I do get a lot of compliments about my smile. It makes me feel more self-confident. My teeth just were not healthy. It did change my eating habits. Foods started hurting my teeth, like steak, corn on the cob. This is something I had to do for me. And now I can eat anything I want. I would never consider dentures. I had my consultation with ClearChoice.
Join the thousands who've already set their smiles free at ClearChoice. Call or click to schedule your free consultation with our team of experts.
Everything was all under one roof. The doctors, the surgeon, prosthodontist, the lab. I walked out of there with the teeth that I wanted, all done in one day. I'm extremely happy that I made that investment in me because I know it's going to last me for the rest of my life. My husband loves them, and I will always have the smile. Always.
Don't wait another day. Call ClearChoice now.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says no more dentures. With us, we have Dr. Cipra. Okay, so Dr. Cipra, you brought in some patient photos and case studies. What are we looking at?
Well, we're looking at a variety of patients here, Randy. This first gentleman comes in and he presents to us with missing teeth, bad smile. He was a manager at a Dollar General store, but his passion is preaching. His goal was to find a church and become a pastor, lay pastor, whatever. But he got his chance. He got his chance to do that during a contact with a patient with another person. He was able to then get keys to a defunct church, and he started it. And he was ready to do this, but he realized he didn't have the smile or the confidence to get up in front of these people. Randy, I should mention that all these teeth had failed and they had to be removed, and he did not want a denture. He knew that a denture with what he was going to be doing was going to be a very poor option for him. He wanted the confidence to stand up there in front of the people and speak. So we had to remove the teeth. We wanted fixed teeth, implants replaced, teeth replaced, and now he's preaching. Awesome gentleman, still comes in, and he's one of his new passion is to talk to people who have had the same problems that he has had, and to explain to them how better they can be in life with a visit to our office. Put the before and afters side by side and take a look. One of the other problems he had was the ability to function and chew, and you can see it in his face. You put in this new set of teeth, and there's a younger look. There's a hey, I'm awake look. The look at me capability is there now. It wasn't there before. He was kind of hiding behind it. Great gentleman. His issue was he was hiding from his wife the entire time, all of his dental issues, which was a combination of missing teeth, broken down teeth, painful teeth. He wasn't eating right. You could tell that just by looking at him. He's a big guy, but he's not heavy. And he owns a computer programming company, so he's busy all the time. And he's talking to clients and patients and people that he works with. So he's in the public eye as well. We changed this all around for him. If you look at the before and after, he's just
totally different guy.
Yeah, I can't say enough about this guy. He's always there. If we ask him to come in and talk to patients, if we need somebody to call another prospective patient, say, hey, this is what worked for me. It can work for you. He's our number one go-to guy.
Now, you use terms like they are back in the system. They're coming in for cleanings.
Yes.
And elaborate on that.
Well, they check out dentally. I mean, let's go back to my earlier comment about patients who haven't been to a dentist for 10 or 15 years. And the reason is their dentist told them at that point, we got to go for dentures. Well, they've checked out. They're not going to go back because they know if they go back, they're going to take the teeth out and they're going to have to wear a denture. For them, bad teeth, broken teeth are better than the removable teeth.
Okay.
So if you can eliminate that fear, the fear of becoming a denture wearer, and put them into some solid teeth, now they're back on track. They're ready to go back out in life and do whatever they were doing before, or doing more than they were doing before. And what we're seeing is they're doing more. They're doing more stuff. They're doing different stuff. They're trying something new. There's a comment I heard one time that says, if you do what you do, you get what you get. But if you want to change what you get, you got to change what you do. So what we're getting these people finally to do is to come in and see us, and we're giving them something that they didn't think they could get.
There are a lot of dentists, and I've talked to a few, that like the snap in, snap out, like giving them a couple snap in, snap out. You don't like that. You like fixed.
Correct. Our patients don't want that. They're not asking for that. They want teeth that stay in. They want to be able to keep them in the entire time, brush them when they're in their mouth rather than when they're in the sink. Go to bed with them in, wake up with them in. So the snap in is okay. It was probably a step toward where we are now, but it's a step backward from where we are now. So if we can do the 4 implants and fixed teeth in the mouth, that's what the patients are asking us for. That's what we're going to get.
How long can they last? Because you say things like these are a permanent set of teeth. How long can they last?
We're hoping, the implants, we're hoping for a lifetime. The teeth, obviously teeth wear. They wear, our natural teeth wear. You know, even crowns that we get on our real teeth wear. These are going to wear. They're going to have to be adjusted in time, maybe even replaced. But boy, the cost to do that is nothing compared to what it would be if you just kept replacing dentures or crowns and bridges over the course of 20, 30 years.
What's your oldest patient?
Our oldest patient is 96.
Really? Why would a 96-year-old want to do it?
Because he wanted to eat, and he wanted to enjoy his family. Matter of fact, my biggest comment to him is I said, just remember there's no running in the halls. So
funny.
and he loves that because it's young. You know, there was a Chinese proverb that says, "Every smile you make makes you 1 year younger." So the more smiles you can make, the younger you're going to feel, and that's what we're trying to do. It's youth, worn out teeth, ugly teeth. It looks like we're getting older before we're supposed to. And so if we can make people feel younger and look younger and act younger, I think we're doing a great service.
Now, we are short on time, so I know you want to show all these photos, so let's, what else do you have?
Let me show you this young lady. She's my representation for a lot of people. We're talking singers and musicians. This is an awesome woman, world-class opera singer, has sung opera all over the world. Her biggest comment, the reason she came in, she said, "My smile is compromising my life." And that has to do with singing. It has to do with just talking to people, smiling. She's wearing a partial denture. She had even gone to the extent of having a partial made that didn't have the silver metal clasps on it because she didn't want to show that because it's on her front teeth. So she needed something that was going to be solid, that wasn't going to move, give her confidence when she's singing. And you know, opera, when you're on stage in an opera, people are looking right in your mouth. And she knew the close-ups were going to be there, and she also knew that she had to hit all these notes. She needed teeth that weren't going to move out on her. And again, this is a woman whose teeth were failing her. We had to remove these teeth. And if you look at her, she's a lovely lady. She's too vibrant. She's too young to go around wearing a denture. That just makes people feel older than they are. So we went in with the implants, fixed bridges. And I think she was pretty when she came in. She may even be a little bit prettier now.
Very nice.
And she does it. She's an awesome person. But she's our representative of many patients in our center who are singers, singing their church choir. They can't. You know, they sing in a group. We have one lady who sings in just a group of women in her retirement community, and she can't do that. We have a gentleman trumpet player. Teeth are moving, he can't hold the trumpet properly in his mouth. Saxophone player, teeth are moving, he can't hold the mouthpiece in the saxophone in his mouth. So there's a lot of people out there, busy people, who want to continue to be busy, do more than what they're doing, and want to do it with joy.
Now, pain, and obviously it's different for everybody, but you say pain should not keep you from doing this. That means the fear of pain should not keep you from doing this. Because it does seem painful, the implant going in.
Well, it is oral surgery, so we're going to have some issues we have to control. But during the actual surgery, the patients are made very comfortable. And after the surgical time, we have medications that we'll give them to
So there are some patients, what do they take, like Advil or something?
Some of them weren't even taking that. But yeah, they may take Advil, they may take Tylenol, whatever. But some patients get away with that. Some patients, not so much. Everybody's pain threshold is different. But the way we do it, I believe, surgically, we control the situation. Let me show you another young lady.
All right.
Dry mouth is a very common side effect of a lot of medications that adults or senior adults are taking these days. And when you get dry mouth, you get decay. She got decay. Broken down teeth, missing teeth, painful teeth. We had to take all those out, put her in a new set of teeth. Just take a look at her, and she's a vibrant woman. She's got a natural-looking smile. The teeth are set up to be age-appropriate. And we have a result that is as good as you and I.
So they look real. I mean, because I always feel like I could spot a denture walking down the street, or veneers. So these are designed, like by you in the lab?
Definitely. By me, the lab, and the patient. It's all about the patient. I don't pick the color. I don't pick the actual
So they're
shape.
involved?
Oh, they have to be. I'm not going to dictate their smile. And it's amazing how many patients come in who say, well, the last dentist just put them in. I said, did you ever see him, get a chance to look at him? Determine if you liked what you saw? No. It's amazing how many times that happens. No, we don't do that. They have to see them and try them in. And eventually, before we're all said and done, they have to okay it. We're not going to finish it until they are happy.
Now, insurance doesn't cover this. Medicare doesn't cover this.
Right.
You offer financing plans.
We do have some financing
for people
plans
to do this. Now, you are a specialty team, and we've discussed on the phone. It doesn't have to cost more to go to a specialist.
Correct.
And with all things being equal, you're all about the same.
We're all about
price.
the same, yeah. We don't change that.
I know you have a stack of photos. I'm trying not to interrupt you, but I know you wanted to show these.
Let me show you this gentleman. This gentleman comes in, and he is dealing with the same problems that the other patients have. Failing teeth, broken teeth, unesthetic teeth. If you take a look at him, you can see that perhaps he's got a different reason. And his reason is he plays Santa Claus every Christmas. He has for 15 years. He's going to continue to do it. That's his passion. But like like a grandparent, he's a grandparent to all these kids. These young kids think he's their grandfather. And what do the young kids say? They tell you the truth. So they're telling Santa Claus that his smile's not too good. And he felt the need to change that. So he's not the jolly old elf that everybody thinks he is. He doesn't have that Santa Claus smile. It came in, we gave him the Santa Claus smile, and he is out there performing
look
as
at that.
Santa Claus. Super. Making kids happy. And he's in pictures, right? He's getting pictures. He's getting his picture taken probably numerous times every day. And now he has a smile to go with the beard. And the common thing with all these people is they tell me they should have done it 10 years ago. Years and years ago. It's why did they wait? They don't know. They're sorry they did.
Okay, good.
Let me show you one other gentleman.
All right.
This guy is a very well-to-do business owner in Tulsa, Oklahoma. And he came up to look at that because he realized that his teeth were failing again. His biggest comment was, he said, my parents wanted me to do braces when I was a kid. I didn't do it. Biggest mistake of my life. And since then, they just kind of got worse and worse and worse. So here he comes in. He comes up to see us. And he goes back home and talks to his mom. His mom's 93. He says, Mom, this is what I want to do. She says, I'm going to think about it. He comes back, goes home, goes to work, comes back that evening, and on the desk is a check written by his mom to pay for the teeth. He doesn't need her money, but that's Mom's view. He comes up, and now he's got new teeth. Man, he says, it's the best thing I've ever done. And he says,
I mean, it looks great.
yeah, in the email he sent, he says, I'm smiling at you right now.
I mean, it looks younger. It almost looks like, I mean, this is like an extreme makeover.
Yeah.
I mean, it looks like it could be that guy's son. I'm trying not to exaggerate.
Well, the biggest issue we have is, the before smiles are hard to get from people. I mean, the biggest before smile we usually see is the one with the hand in the face. And there was a comment that was made at one point, says, you cover your mouth when you cough, but you don't cover your mouth when you smile. So you got to have a smile that you're willing to show.
We're going to take a quick break. We are short on time. We come back, more of the photos and what people can expect. We're talking about dental implants today. According to Dr. Cipra, no more dentures. Nobody should be wearing a denture. And if you're headed for dentures, you got to hear this next segment. I'm Randy Alvarez. We'll be right back.
You have to have confidence on this job. Anything that takes away from that puts you at risk.
I get compliments all the time. Oh my God, I can't believe how beautiful your teeth are. My self-confidence has gone up. The smile is one of the first things that people see. I mean, I used to always smile. I would keep my lips on my teeth. My dental problem started years ago with fillings and root canals. And I was looking at some point, my teeth falling out. I had to do something. ClearChoice didn't just give me new teeth. They set me free to be who I want to be.
Join the thousands who've already set their smiles free at ClearChoice. Call or click to schedule your free consultation with our team of experts.
It was a one-day process. I would walk out with a smile the same day. The lab, the surgery, any work that you need done, it's all done at one location. They not only helped to rebuild my smile, but helped me to rebuild my self-confidence. They really set me free. I mean, look at this smile.
Don't wait another day. Call ClearChoice now.
You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about replacing missing teeth with dental implants. And for you denture wearers, with as little as 4 dental implants, you could get a full arch of teeth, according to Dr. Cipra. Is that right? So
Absolutely.
So just 4 implants, they get a full arch of teeth.
4 implants.
And they could eat and chew, whatever.
Absolutely.
Okay.
Let me show you this young lady. Comes in with an upper denture, lower partial. The T3 that are holding the partial are failing, so they have to go. And the last thing she liked about any of this was that everything hurt. So we took the teeth out, changed the denture over to a implant-supported bridge one day, and now she's chewing, eating, smiling. The lady smiles all the time. Once we changed that denture wear to a user of fixed bridge work, changes their whole diet. They're eating salads, they're eating steaks, they're eating raw carrots again. They're actually chewing peanuts and cashews. It's a life-changing diet. The nutritional value of the food that they can now eat is huge, much better, much better. And that's what they see. The more teeth you're missing, the worse your nutritional value is. So you're not eating the right foods because you can't. So now that you can chew, life is going to be better. Here, let me show you another young lady.
All right, time for one more.
Okay.
This is good.
Same basic problem. Comes in with partial dentures. Painful. Comes in with her daughter, which is great. When you can bring a family member and they can see the changes that we can do. It really helps everything. So she comes in with her daughter. She's in pain. Doesn't smile. Daughter's telling us this. Changed everything. The remaining teeth were not in the best shape. She opted to have those removed, which was great because that was going to be the best thing for her for the rest of her life. Put in a new set of teeth that are anchored with the 4 implants, top and bottom. She's smiling like a champ now, just happier as a clam. And the daughter tells us, yeah, it's a different mother. I got a new mother. We have a number of people coming in. They're looking to be able to chew better. They want to be able to function and chew their food properly. And we give them that and a smile. And now they're more worried about, hey, they're so happy they got this smile. Then we have the people coming in looking for the smile, but we give them the chewing ability as well. So now it's like, hey, I haven't had a steak in a decade. Now this is awesome. And a smile is a great thing. Phyllis Diller made a comment one time. She said, a smile is a curve that sets everything straight. And then there was a comment that said, a laugh is a smile that bursts. And Victor Borge, if you ever remember Victor Borge, he used to say, laughter is the shortest distance between two people. So what we're doing is we're taking the reclusive patient, the patient whose smile is the back end of their hand, putting a smile in their mouth, and allowing them to share that with people. And the world just changes for everybody. So that's
Wow.
really, that's where the transformation of a life changes. The quality of life goes up exponentially. And we see it every day. It's awesome.
We are out of time. I want to thank you for coming on the show. But final message to the person, they're wearing a denture, they're still skeptical, right? Or they're headed for a denture. What do you say to them?
Come in and see us. It's a free consultation. It takes a little bit of time. That's all you're going to have to expend. But it gives me a chance to evaluate you, identify what the issues are, and offer you a life-changing treatment.
Good.
Come visit.
Good. Thank you so much for coming. That was excellent.
My pleasure.
Excellent. And they could go to your website, learn more,
Yep.
those kind of things. And they could even see you at the center if they want. Is that right?
I'm there every day. You'll see me for sure. If you come in, you can't miss me.
All right.
I'm in the way.
All right. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.